sharps container.
Exactly. All right. So you can see on the syringe itself, we've got the numbers, we've got the graduated lines. The numbers are next to the longest lines. That's where you're measuring to.
Okay.
On your plunger, you've got a top black line and a bottom black line.
Mm-hmm.
When you measure until your top black line is lined up with the long line of the number. So that's 0.1 milliliters.
Understood.
Okay? All your vials are going to have this little bullseye pattern. You want to put your needle somewhere in the inner circle, but it doesn't have to be dead center. Okay? So there's a couple different ways to draw up the allergy vaccine. I'm going to tell you about one way. Your wife may have learned a different way, but it's all
Similar functions.
exactly. So when you're ready, take your cap off your needle and you stick your needle in the inner circle somewhere. This is sterile saline I'm showing you.
Okay.
I'm going to show you to 0.2 milliliters, which is the second dose, just because it's easier to see what I'm doing with a little bit more. Okay? So you flip your vial upside down and pull down on your plunger until you're past the amount that you want. So you want to overfill your syringe.
Okay.
We're doing this because you see that little air bubble up there? Exactly. This injection is going subcutaneously and it's a small amount of air, so it's not going to hurt Hazel, but it is going to affect our dosing. So we want to get rid of that bubble. And to do that, you hold the vial so it's near your palm but not actually touching it, because I'm going to flick my syringe. And I don't want to... Bless you. And I don't want to flick my syringe out like this because it could go flying across the room.
Okay.
So I'll start to flick into my palm. Oh, I bent it, so you gotta be careful. Sorry, I flicked that too hard. Okay. There we go. Okay, and you kind of see how there's a little bubble in the center there?
Mm-hmm.
So the bubble is in line with the needle, so I know that when I push my plunger in, it'll shoot back into the vial, and that's what I want to happen.
Okay.
If you move it around too much, the bubble will get out of line, which is what I just did.
You're doing this though to show me, which I appreciate. You're doing it consciously.
There we go.
I'm using my elbow to touch stuff.
So then when you notice your bubble is like that, you push your plunger back into your vial until you're at the amount that you want.
Okay.
Okay? Then you come over to Hazel. Hello, Hazel. Come here, sweetheart. Come here, sweetie. Let me just grab a spare one that's
Okay.
not bent. So I can...
Come. Go. Sit. Down. Down. Good girl.
Sorry about that. Oh, hello, Hazel. You on the table. All right, so I'm going to show you with a cap needle. Then I'm
Okay.
going to do it with the sterile saline, and then I'm going to have you give the first injection if
Okay.
you're comfortable with that.
Yeah.
All right, so if you feel where my fingers are,
Mhm.
those are Hazel's shoulder blades.
Yep.
We're going to give the injection right around her shoulder blades.
Okay.
You can technically give it as far back as her last set of ribs, but the further back you give it, the more she's going to feel it.
Okay.
Also, there tends to be a little bit more extra skin up here and a little less down here.
Okay.
The other thing is, not that Hazel would do it, but if she decided to object to what you were doing and turn around and try and give you a little nip to tell you, your hand's back here, she can nip you faster and easier. Over here, you've got a little more time to get away. Okay, so. Hazel, you're a very slim girl. You don't have a lot of extra skin. So, feel around her shoulder blades and then pick up as much skin as you can.
Okay.
With her, you're not going to get too much, but you don't want to do kind of like in
Yeah.
between your fingers because you're not going to get enough skin and you're going to kind of pinch her.
Okay.
So I grab as much of her skin, make a little indent with my finger just as a guiding point. You don't have to do that. It's kind of just, this is where my syringe is going to me. So you take your syringe and you line it up so it's parallel to her body.
Understood.
And you're going to do a nice, hard, fast flick of the wrist into that little pocket you just made.
Okay.
Once your needle is in her skin, you're gonna pull back on the plunger again. You're gonna do that for two reasons. One is I wanna make sure no blood comes into my syringe. If it does, it means you've gone through a capillary. It's not a big deal, but we do want you to take your needle out and put it somewhere else.
What's a capillary?
It's a very small blood vessel.
Okay.
Will be a very small amount of fresh blood in there. Her body will dispose of it properly. That's the only time you can reuse these needles. Otherwise, they're single use only.
Okay. So if I do get blood, just do it somewhere else.
Exactly. Pull
and
out.
The blood in there is just go for it.
Exactly.
Okay.
Her body will just take care of it.
Okay.
The other thing we're looking for is a change in pressure in the syringe. So the most common error that happens when we're giving subcutaneous injections is instead of the needle being underneath the skin, the needles come through and gone out the other side of the skin. Yes. So, yeah, kind of like a piercing.
Yeah.
So to check and make sure that hasn't happened. Now, Hazel's not super fluffy, so you could potentially see it, but sometimes it's pretty small, you don't necessarily see it. To check and make sure that hasn't happened, that's why you pull back on the syringe.
I'll throw the box away because the box is empty.
Oh, okay. Oh, sorry about that.
No, that way you don't have to touch it.
Oh, thank you. So when I pull on my plunger and I let go of it out here in the room here, it stays exactly where I put it because the pressure is exactly the same out here as it is in here.
Yep.
When the needle is underneath her skin, the pressure under her skin is different than the pressure out here. So if I pull back and let go, the plunger is going to start to move back in on its own. And so when I see that it's starting to move back in on its own, I know that's under her skin, so I can depress the plunger fully, pull it straight out, and I'm done.
Okay.
Now the only caveat to that is sometimes when you're giving the 0.1, you don't necessarily see the move back in, so sometimes you got to give the plunger a little tap to see it happen.
Okay.
That's why I show with the 0.2 because it's easier to see that kind of stuff. All right, so I'm gonna give this with the sterile saline. So grab a bunch of her her skin, excuse me. Make a little dent for myself. Do a nice fast 1, 2. Then I pull back, let go. You see it move? Yep. So I know it's in there. Push, pull straight out.
That's off. Hi, good girl.
And that's it. You're a good girl. You did it. You perfect lady.
Sometimes.
Yeah.
So we did not give her the Apoquel this morning.
We're gonna keep going with the Apoquel.
Okay, I just wanted to check, and we still have. This is the last. I forgot what the red pill is.
Okay, so we'll give the last pill also.
I forget what it is.
It's an antibiotic.
I just wanted to check before we gave her this morning.
So with the Apoquel, we're going to keep going with that for a little while because it takes 2 to 4 months before we start to see effect. So usually what we tell people to do is, I know, sweetheart. Yes, you're a very good girl.
I got a 60-day supply.
Great. So usually what we tell people to do is every 3 to 4 weeks, stop the Apoquel for a day or two and see if you see an increase in itching.
Okay.
If you do, restart it and try again.
That would be hard for me, but I will. So that was every 3 days?
Every 3 to 4 weeks.
Oh, 3 to 4 weeks. Stop it for a couple days.
Yeah, exactly. And just see if she's still...
Instruction, every 3 to 4 weeks, stop for...
1 to 2 days.
1 to 2 days and see if Hazel starts itching after not taking the white broken up pills.
Exactly. And some dogs will see 6 to 9 months before we see full effect of the injections, but you should start to see something by 2 to 4 months. We do have those rare cases that we don't see full effect until a year, but again, those are more rare, but they can happen. All right, so I'm gonna give you, is that a new one? I'll give you this. So we don't use your supply. I'll hold on to Hazel. Great. Perfect. Yep, and you can start with it upside down too, that's no problem. Good. It'll take a little time for your hands to get used to the movements. So
I make a horrible junkie.
Yeah, don't be surprised if it feels super awkward at first. So what you can do to get it to move, kind of, is you can put your index finger on these little wings here and push against that while you pull down with your middle and thumb. Okay. So that'll help you maneuver it a little bit. And you're gonna wanna give it real hard flicks. Yeah, you can even hit harder than that. Good. And in the case where you have a stubborn bubble that doesn't wanna go back in, actually you took care of it, but,
I see a little bubble.
okay. In the case where you have a stubborn bubble that won't go back in, what you can do is you can push everything back in the vial and then pull down slowly again. You'll still get some bubbles, but they might move a little more.
Dislodge. Okay.
Exactly. But you can just, you got rid of them, I think. Yep. So we can push back in until we're perfect. All right, so you pull the needle out of the vial. And then you come over to Miss Hazel.
Hi, Muffin. So this is where I give her tick juice.
Exactly. And anywhere around the shoulder blades you can get extra skin. Perfect.
And I didn't see any movement.
Good, so we'll pull back on the plunger.
Oh.
So kind of like,
There, okay.
yep, and now push in. Oh,
Fuck.
that's okay. That bubble's okay because we know our dose is accurate.
Oh, okay,
Yeah,
we're
so-
not worried about the air.
No, it's too small. There you go.
Sorry, Bubba.
Perfect. Good. Good. And pull out. And you're done.
See if it feels wet. Did I get it in?
Yeah, you did.
That's it, Bubba.
That was
And
it.
then-
Exactly. Perfect.
I should have used a flat surface.
Yeah, but that's okay. You did great.
All right, that's it.